Good afternoon. Welcome to the weekly update from the Department of Behavioral Health. I hope all is going well with you. A reminder that this month we are honoring and celebrating Black History Month. Today I wanted to talk a little bit about Fannie Lou Hamer. Fannie Lou was inducted into the National Women's Hall of Fame for her pioneering work around civil rights and women's rights. Fannie Lou was born in 1917, and she grew up on a plantation where she was a sharecropper in a sharecropper family, went to a one-room school for sharecroppers' children, where she learned as much as she could, and later became interested in civil rights, tried to take the test to be able to register to vote, and at that time they had created the test to try and keep Black people from voting. And so it took her a while to be able to pass that test. And when she tried to register to vote, her boss fired her. But what I wanted to highlight, I highly recommend that you look up Fannie Lou Hamer, a lot of interesting information about Fannie Lou. But one of the things I wanted to highlight is that in 1961, in the decade of my birth, Fannie Lou went into the hospital to have a uterine tumor removed, and without her permission, the doctor did a hysterectomy, which resulted in her not being able to have her own children. And that was a common procedure then, particularly for poor African American women, where doctors on their own would sterilize women. And as a result of that, Fannie and her husband ended up adopting two children, and sadly, one of them died when they needed hospitalization, and because of her activism, they refused to admit her. So I highlight those things because we hear a lot about distrust of the medical system, and there are reasons for that. It's not without cause. And so again, I really encourage you as we celebrate Black History Month to dig a little deeper, learn a little more. A reminder that we have our library where you can check out books to learn more about Black history. I've been reading some, and I highly encourage you to as well. All right, the other thing we're celebrating is Lunar New Year. This celebrates the beginning of the new year on the lunar calendar. And this year it is tomorrow, Friday, February 12th. Lunar New Year is also known as Spring Festival, and it is usually associated with Chinese New Year, the Spring Festival. It's also observed by other cultures who observe the lunar calendar. Very rich traditions in this cultural holiday, and so some things that you can do in honor of Lunar New Year: tidy up. That's a recommendation. Take time to restore order in your home. Clear out the old, make room for the new. Treat yourself right. Kind of like how the Western world celebrates New Year, New Year's resolutions. Treat yourself right. Put family first. Give generously. Pay your debts, and know when to take a break. And knowing when to take a break is a really important thing, as we're all stressed out with this pandemic. And so a good reminder for all of us to take those breaks throughout the day and give yourself a break on the weekend and such. All right, on to COVID. So we're now over 107 million COVID cases across the world, with 2.3 million deaths. Far, far higher than any of us could have imagined a year or so ago. And in the United States, we have 26.6 million cases and 453,000 deaths. In California, we have 3.3 million cases and 45,456 deaths as of yesterday. We are testing a lot. We've administered almost 45 million tests in the state of California, and we're also now approaching 5.3 million vaccines given. Of note, the positivity rate in California continues to go down. As we reported last week, we're now at 4.6 positivity rate for the last 7 days. That's really welcome news. Same in Fresno County. We're now at 91,876 cases. We are now approaching 1,300 deaths. We have 1,283 deaths, both of those big increases over last week. In terms of hospitalization, significant downward trend in hospitalization. We're at 344 positive patients in the hospital as of yesterday. 87 of those are in the ICU, leaving us with 15 ICU beds. That's the most ICU beds we've had in several weeks, but a gentle reminder, I do this every week, that our summer surge, we peaked at 313 individuals in the hospital, so we're still well above that. And on our calls, we're definitely still hearing from hospitals that they are well over their routine capacity. And so we need to continue to see that number go down in order for them to have relief. In terms of the tier system, remember after the governor lifted the stay-at-home order, we went back to the tier system. Fresno remains in the purple tier. We are at 9.7 positivity. We have to get under 8 to get out of the purple tier. We're at 30.3 new cases per 100,000 people. We have to get under 7. Our health equity metric, we're at 12% positivity rate. That needs to come down as well. And so we're getting closer to the red tier, but it's probably going to be a few weeks if we continue on this trend before we see the numbers we need for the red tier. And remember, the red tier will enable a little more opening of businesses and particularly restaurants and such. So what's new? Well, the variants are here in California. They're not prevalent in Fresno yet as far as we know, but definitely something that's being watched closely. In terms of vaccines, you may have seen in the news, we were tracking at about 8,000 vaccines being delivered to Fresno weekly, and that really has not been enough to keep up with the demand. And this week we received 19,000 doses, so a little more than double what our usual. What we're trying to figure out right now is whether or not we'll stay at that 19,000 doses, which would enable us to expand clinic operations again, but that remains to be seen. The Johnson & Johnson vaccine is up for approval. It's going through the FDA's process later this month. If that vaccine gets approved as it is expected to, that is the one-dose vaccine, and that will hopefully increase our ability to vaccinate by providing more vaccines for the clinics. There was an article in the paper, I think today or yesterday, about a vaccine being developed that would address all coronaviruses, including those common cold coronaviruses. So that would be really exciting if we could come up with a vaccine that would take care of the known and the future coronaviruses. So stay tuned on that one. And then the other thing that came out this week is a recommendation from the CDC on double masking. And so the CDC is saying if you're able to, double masking is recommended. Specifically what they're recommending is a cloth mask over a surgical mask. This is not to be confused with the recommendations for healthcare, which is the N95 still. The N95 mask, also known as a respirator, is the highest protection that can be offered. And so for the general public, this double masking is something that can be considered. Okay, I got a few questions after last week's meeting, and so I wanted to answer these questions. There was a question about an assumption that we were returning to work in March. I think that comes from my report out that the work from home order through the county is through March. I wouldn't presume that that means automatically that we would return to work in March. I think that just like we've done throughout this entire pandemic, it's a day-to-day, week-to-week proposition, really depending on the number of cases in the community, what happens with the variants, and also what's happening with vaccinations. And so I wouldn't make any presumptions about when we'll return to work or how that will look. And that was another question about the COVID numbers, if we're dealing with that. And also, what if you have someone high risk in your home, maybe someone who can't take the vaccine for whatever reason? These are all things that will be considered as we move along. I will say, I've said it before and I'm going to reiterate it. We will at some point return to what I'll call the new normal. And our new normal will have all of the safeguards that are available to us to put into place to ensure that we've created a safe working environment for you and for the people we serve. And once we've done that, we're really going to be focused on how to best meet the needs of the people we serve. Of course, again, we would have that safe environment, but the focus will be on meeting the needs of the people we serve. We know today that while many of the people we serve are getting at least some of their needs met by virtual treatment, not all are. There are some people who don't have access to the technology to do telehealth. Telephone, I think generally is believed, while it's not ineffective, in many cases may not be as effective as telehealth or the video conferencing. And some people just do better with in-person. So I don't anticipate that we're in our new future that we're going to have a period of time where we don't see people in person at all. And so I think, as we build out the Olive building and such, we anticipate creating space where people can offer telehealth services from their office to people who aren't able to get in. I think that will enhance the services we provide. We'll certainly be looking at what work can be done from home, and we'll also be considering whether or not that would be something we would be offering long term. But we're pretty far away from making those determinations. So I would just ask each of you, please don't make assumptions, and rest assured that we'll be reviewing all of those things carefully and critically as we move forward. Some questions about the effectiveness of the vaccines on the new strains. At this point, all of the vaccines have some effectiveness on the new strains. Most of them, some better or worse than the others, have a little less effectiveness on the South African strain than on the other two strains, which are the Brazilian and the British. And all of the vaccine makers are looking at how they can configure a booster shot that would be effective against all of those strains. But remember from last week's presentation that effectiveness of the vaccine isn't a black and white issue. So what I mean by that is less effective doesn't mean not effective. So for instance, the Johnson & Johnson vaccine is known to be 66% effective versus the Moderna and Pfizer, which are 95%. What that means is 34% of the people who got the Johnson & Johnson vaccine had some mild symptoms of COVID after they had had the vaccine. So they were exposed to COVID, maybe got COVID and had some mild symptoms. But thus far, as I shared with you last week, individuals in the vaccine trials who received the vaccine are not experiencing severe illness, moderate illness, or even death. And so the effectiveness means a reduced negative outcome from getting COVID. And so even if the vaccines are a little less effective with the new strains, they still would help you not get as sick. And so there's no reason to throw in the towel that if you got a vaccine, it's not going to help if this terrible South African variant gets here. And also, keeping in mind that we might get a booster shot sometime in the future that would give us that added protection. And then I've already talked about work from home being continued. Somebody had a question that they retracted. I don't see any other questions. I'm going to go to my next slide. So telework is expected to be continued through March at a minimum, but will be extended based on a number of variables that I already mentioned. What tier are we in? What are the volumes of COVID in the community? What's happening with the variants and what's happening with vaccinations? So while we definitely see light at the end of the tunnel, we definitely can see a time where we will return to normal. We don't have a date for that yet. Testing is ongoing, and again, whether you've had the vaccine or not, we highly encourage you to be tested if you have symptoms. And CDC also came out with new guidance that if you've been exposed to someone with COVID and you've been fully vaccinated, which means you're at least 2 weeks from the second dose, it takes about 2 weeks after any dose of a vaccine to get the full immune response from that vaccine. If you're 2 weeks from the second dose, you do not have to quarantine if you've been exposed to someone with COVID. If you did later test positive for COVID, you would isolate that 10 days or 7 days if you have a negative test or if you have no symptoms and such. And so that's kind of what we're looking at right now. I imagine the county will be evaluating this new guidance from the CDC and accommodating our policies and practices and such because of that. All right, let's see if we have any questions. Do we have any via text? All right, I'll give it one more second or two to see if we have any questions, but as per usual, if you have any questions after this presentation or you're viewing the presentation as a recording, please email myself or Tina Young, my assistant, what your questions are. We'll reply to you via email, and we'll also bring it up next week if it's something we think might be relevant to the rest of our viewers. And with that, we will end this presentation, short and sweet today. Have a great holiday weekend. Please take your breaks, and happy Lunar New Year, and we'll see you next week.